Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the personality disorders. The central feature of abnormal personality is some degree of persistent abnormality of behavior, which is frequently but not necessarily antisocial in its manifestations. The abnormality varies in degree, ranging from schizoid to hysterical people who are often valuable if somewhat unstable member of tech community, to psychopaths who are socially destructive. Obsessional personality. Those people give little regard to the emotional aspects of a situation or a interaction. The patient is rigid, over attentive to details than to wider scope of an event encounter and prefers to have everything predictable and orderly. He often appears officious, comical and not only controls himself excessively but also attempts to dominate others. The patient appears to behave in an excessively egotistical manner and responds in an overriding way when involved in a venture calling for cooperation. The patient is over careful, methodical, linking things cut and dried, concerned with neatness and orderliness. He can be very meticulous, punctual, and over organized to the extent of becoming uncomfortable and even upset. If his routines are disturbed by any unexpected development, the patient has a setup of fixed standards and points of view from which he can deviate only with a great difficulty, not influenced by other people. Neatly dressed, pays more attention to small things, works compulsively and don't think of relaxation. At times he appears to leave some loophole so that the conformity, inhibition and rigidity is waived in some context or other. The gross form of disorder is easy to recognize. Milder forms may be less obtrusive and may be particularly evident only at times of pressure, as when the examination is looming for a youngster or when a house proud woman has a relative coming to stay in her home. Schizoid personality. The patient is so solitary, aloof in his loneliness, detached and distant from other people, preoccupied with some impersonal activity in the realism of science, etc. Often the engrossing venture is a personal pad of invention which may be of negligible application in orderly life. Cold, quiet and shyful, lack of friends may apparent since childhood. The person may appear odd, eccentric, and in his awkward isolation may appear as a figure of fun. The patient may seem secretive, can't work in a team, bookish, will have strong emotions which they can't express, indulge in daydreaming, or succeed in establishing some relationship in which the expression of emotion is allowed. He is at times mistrustful, seeing slight where none is intended, don't care for others' intentions, wishes, and feelings, uncomfortable mining with others. Suspicion can become prevailing response to others. The person believes that he is exploited. Some doctors may diagnose it as paranoid management. The patient responds to clinician in accordance with their particular personality deviation. For this reason, diagnosis of the personality type permits the doctor to plan management realistically, so that he does not expect a degree of cooperation which the patient is not equipped to provide. In addition, he will be better able to predict the patient's pattern of behavior in future. The doctor helps the patient discover some modifiable aspects in a problem which she considered insoluble. That's all about the personality disorders. In the next video, I will discuss about some other disease. Thank you.